Good morning. Welcome, everybody. We are going to be going through our fourth E-QIP webinar today as part of our series. And this particular webinar is the second part of the diagnosing of the problem. And of course, this is partnered with part of the Excellence Through Quality Improvement Project. So we're all happy that you're here today. So myself, Laura Daly-Trache, and Anna Mugimba will be going through this series of this webinar with you today. So on the agenda, we have what is E-QIP? So we'll be going through that. We'll be also talking about the model for improvement, doing a recap of what we've done so far in the previous quick webinars, and then taking a look at two additional diagnostic tools that can be used in your QI work. One is the process map, and the other one is experience-based co-design, EBD. So the Excellence Through Quality Improvement Project is a partnership between Addictions and Mental Health Ontario, Canadian Mental Health Association, and the Ontario and the Health Quality Ontario to promote and support quality improvement in the community mental health and addiction sector. E-QIP is based on the sector's existing commitment to provide high-quality, person-centered care to individuals and families. And the guiding principles that we have for the project is utilizing three different models. One is the model for improvement. One is looking at the domains of quality, and then that quadruple aim. The model for improvement we'll be reviewing where we're at within the model today with these tools, and as well, always keeping in mind that our work is headed towards those six domains of quality, which are equitable, timely, safe, effective, integrated, and client-centered. And of course, aiming for better health for the people we serve and also for those that are doing that work. And the example that we're going to be using today is the case study that we've been using through the first three webinars, and that is the looking at a quality issue of wait times at the Live Well Recovery Service. And in this case study, we'll use to demonstrate how to apply the QI tools. And specifically, this case will look at the long wait times for the case management program of the Living Well Recovery Service from referral to service initiation. And just as a recap, the QI project looked at the wait times that the clients were receiving accessing case management services, and at that data point was 185 days from the time of referral into the program to service initiation.
Thank you, Laura. So here we're looking at the roadmap for the model of improvement. And in this webinar, we're at the second stage of understanding the problem. Right now, I'm going to go through the steps of a process map, and Laura is going to come back on and go through the steps for EBD. So the diagnostic tools help the team identify the root cause of the problem that they're trying to solve. And in the project charter, you could enter the root causes in this area circled on your screen. So simply put, the diagnostics gets to the root of our problem. So now that we've we created our problem statement, and we want to ensure that we have gathered as much information as we can about the current process that we're trying to improve. The best way to do a process map is to use Post-its on the wall where everyone can see and everyone can add comments. So here are the symbols for the process map. And if you notice, every step has, every symbol has a different step and meaning. And these are the symbols that you would be using for your process maps to define your process. So how do you make a process map? The first thing you want to do is involve the people closest to the work, or determine a way how to solicit input from these people. Secondly, you want to determine the frame or the boundaries of the process. So where does the process being studied begin and end? Next, you want to determine the steps of the process. And a way to start this is to brainstorm a list of major activities, inputs and outputs, and decisions onto a flip chart from beginning of the process to the end of the process. Sequence the steps by arranging the steps in the order that they are carried out using Post-it. Draw a process map using the appropriate symbols, like I showed on the previous slide. And you want to make sure that you are, excuse me, that you're consistent in the level of detail, and label the process using words that are understandable to everyone. The next thing you want to do is test the process map for completeness. Are the steps in the process clearly identified? And do you have all the steps lead to the end of the process? And finally, you want to finalize the process map. So here's an example of a process map for our Clubhouse program example, showing the high levels of how someone becomes a community Clubhouse member. So you'll see that they use the shapes to identify each step in the process. They also have the arrows, the flow arrows, that show you how the process goes through each step. And it identifies a clear beginning and a clear ending.
Thank you, Anna. The next tool that we're going to walk through is the experience-based co-design. And we're going to specifically talk about how to capture and understand the client experience with this particular tool today. And within the model for improvement, you'll see off to the left-hand side, the experience-based design tool aligns with understanding the problem and helping us understand what it is that we're trying to accomplish with our improvement area. So along with the fishbone, the 5 Why, the process map, and others, this tool can support you as you seek to understand your problem, but this one is from the client's perspective. This tool has 4 different drawers, if you will, to the kit. One is the capturing the experience tool. The other is understanding the experience. The third is improving the experience. So taking those tools and turning the experience into an action. And then the 4th tool is measuring the improvement. And within that piece, there are different tools for evaluating and measuring the improvement. This toolkit was developed by the NHS Institute for Innovation and Improvement, and you can download this from their website, which is at www.institute.nhs.uk, and the guide is found under the Resources tab. Within the EBD Capture Toolkit, you will find 2 different types of tools. One set of tools measures the breadth, the other depth. Some examples of breadth are emotional questionnaires, focus groups, and observation. These tools are used across a larger number of clients. The depth tools, such as interviews, shadowing, filming, and photography, are used on smaller numbers of clients to capture a more granular picture of the experience of those you are serving. As mentioned previously, one of the tools we can use to capture the experience of the client is the use of an emotion questionnaire. Here is an example of a questionnaire using the Living Well Recovery Services QI project. You will notice that we have used the high-level steps that were identified in the process map exercise to populate the questionnaire. Consent to be referred to the ICM program, assessment for ICM, client notified of acceptance or not, and if accepted, the first day in the program. There are an equal number of negative emotive words and an equal number of positive emotive words that you'll notice under each of those high-level steps. This team also wanted to know how clients were feeling in between the process steps during the waiting periods. So they've entered that information into this questionnaire as well. So service recipients can circle one of the emotive words on the list or write down an emotion that is not reflected on the list. So we wanted to give them an opportunity to insert in their own words how they are experiencing it. And the key is to have the client write down in their own words what it is about the process that made them feel that way. So what was the trigger? And this is an identified set of reliable emotion words that you can use in your own work. So to the far right, there is a list of a final 20 positive words and a final 14 negative words that have been developed. And you can just take a look at that list to populate your own questionnaire if you feel inspired. So after you've asked a number of clients about their experience of the process, and in this case, the Living Well Recovery Service, you can then map the positive and negative emotions along with the positive and negative triggers in a chart similar to this one that you see on your screen. You will notice that if an emotive word was used more than once, the font size increases by the number of times the word was used. And in the example on your screen, the words supported or positive are highlighted under some of those positive and negative emotions under the assessment for ICM and then under the client notified of acceptance or not. So you can take a look at that and determine visually where you want to focus some improvement efforts potentially. Oftentimes, we seek to include our service recipients in a patient and family advisory table, for example. We seek their input and engagement, but we often fail to ask them to be part of the redesign of the service that we are looking at. And so this is a great way to solicit their input on how they're feeling, but then what do we do with that information afterwards? And with this experience-based co-design, we really want to see folks participating in our improvement efforts to help us design something better with them. And then, of course, we want to know whether the work that we're doing to improve this process with the help of our clients, whether we're actually headed towards an improvement at all. So we're just going to show you a few slides that will demonstrate different ways to show measurement when you're looking at experience-based design. And oftentimes this is what we'll see is a run chart that will show us data over time, either an improvement up or an improvement down. And with experience-based co-design, there are different ways to display the same data that might speak to the people that you serve, or to a board of directors, or to supervisors, or just into the community at large. But different things like a Wordle over here on the left side, so showing before what you surveyed through the experience-based design questionnaire at the outset, and then after the improvement, what were the words that people were relating to afterwards. And then you can also use pie charts, rolling graphs, and as well bar charts to show some of that quantitative data using the data coming out of your experience-based co-design efforts. And of course, that measurement is telling us whether what we're doing is actually leading to an improvement, and it all aligns with the model for improvement. So experience-based co-design is an important part of any process that you're trying to evaluate within your service that it involves clients. And it's a natural way to build on your relationships with your clients and also with your staff. It's a great engaging tool to use. It can actually potentially reduce the workload on your staff, especially if your clients are actually taking on some of the improvement actions and carrying out the change ideas themselves. It really can take some weight off of your staff. And it's also a way to keep the momentum of change moving. Involving your clients will contribute to the enthusiasm, drive, energy, and level of expectation when it comes to your staff. So that's it for today's webinar. For more information about E-QIP, you can always reach out to either Michael Dunn, Debbie Bang, or Jenna Hitchcock, and their contact information is on the screen there. And if you'd like to stay involved or informed of future webinars and training events, we encourage you to click on the link there. And we're very thankful that you were here today.